Glaucoma as a disease is probably the most interesting thing I treat. We take care of a lot of glaucoma in our practice between my two general partners and I. And I'm just very interested in the disease because each person that walks in the door with glaucoma is a different disease, a different patient completely. There's not a lot of cookie cutter things in glaucoma. There can be a patient walk in the door with a pressure of 28 and their eyes completely normal with no damage, and they don't have glaucoma. They've just got high pressure. You have a patient with a pressure of 15 that's actively losing vision because that pressure is too high. And so it just makes it an interesting disease to treat because there are so many factors that are involved, some of which we just really don't understand still. Trabectome was new to me yesterday, as of yesterday, and having gone into the OR and done this for the first time, I had done angle surgery for probably about 3 or 4 years now, so I was a little bit more comfortable doing the trabectome for the first time because I've been in the angle doing surgery under a gonioscope previously. So it wasn't quite as nerve-wracking as the first time I'd done any kind of surgery in the angle. I felt fairly comfortable doing it from the first time. The first case was not overly difficult to do, and there was no complications, and it felt very smooth. Baby did really well. Getting ready to go in and see one of my patients who I just did my first trabectome on yesterday, and see how her eye looks and how her pressure's responded. All right, here we come. All of us.
All of us.
How are you this morning?
Fine. How are you?
Good, good. How are you this morning?
Fine.
All right. Look at my ear. Look at those eyes here. 14. Wow.
Praise the Lord.
Yeah. Kidding. Sit back for me.
That's the first time ever.
Yeah, that's a really good pressure this morning. That's better than I was expecting. So we were 25 before we did this, I think was the last pressure, is that right? As high as 30, 31, but with all these medications we were 25 last visit. Yeah, that's really good. Seeing the patient in the office this morning was impressive. I was expecting pressure, her pre-op pressure was about 25. It had been as high as 30 on the same medications, but most recent pressure was 25 on, I think it was 3 different glaucoma medications. And when I saw her in the office this morning, her pressure was 14. And I really wasn't expecting it to drop like that. I really thought it would still be high being on steroids, and I thought the pressure would be elevated for a little while and it would kind of slowly come down if it was going to. I was pleasantly surprised with a pressure of 14 this morning.